to the last lesson of CPR first aid with me. Today we're going to go over broken bones and sprains, burns, the different types of burns, and CPR. So broken bones and sprains. So important info, joint sprains happen when joints move in directions where they're not supposed to go, and without an x-ray it may be impossible to tell whether a bone is broken, but you will perform the same actions even if you don't know where the bone is broken. So what are the signs of a broken bone or sprain? There may be swelling, and the joint may turn slightly blue if it's sprained. So steps to treat a broken bone and sprain: make sure the scene is safe, get the first aid kit, wear PPE, cover any open wound with a clean dressing, put a plastic bag filled with ice and water on the injured area, with a towel between the ice bag and skin for up to 20 minutes, phone or ask someone to phone your EMS. If there's a large open wound, the injured part is abnormally bent, and you're not sure what to do. If the injured body part hurts, the person should avoid using it until it's checked by a healthcare provider. Now here's an image. Splinting broken bones. You may use a cold pack, but it must not be as cold, as it won't work as well as ice and water. And don't straighten any body part that is bent or deformed, and don't move a broken bone that has come through the skin. So here are the steps for splinting. Make sure the scene is safe, get the first aid kit, wear PPE. To make the splint, use something such as a magazine that will keep the arm or leg from moving. Ideally, place the splint so that it extends beyond the injured area and supports the joints above and below the injury. Tie the splint to the injured body part so it supports the injured area. Use tape, gauze, or cloth to secure it. Make sure the injured person is checked by the healthcare provider. Here's an image. Same thing, we can see the magazine rolled up, and we have tape to keep it stiff. Now, splinting broken bones or other, a video. Now, FYI, you should be able to put a few fingers between the splint and the injured body part, as you don't want to tie it too tightly, as it may cause further pain. And if it's possible, keep the person comfortable. So if the injured part is bleeding, apply direct pressure to stop the bleeding, and apply a dressing to the wound before applying the splint. So here are actions of splinting broken bones on yourself. So making sure the scene is safe, having the injured person place his hand across the chest and hold it in place with their other arm. Now, splinting broken, same thing. Now, burns and electrical injuries. Burns. What are some causes of burns? Heat, electricity, and chemicals. So use cool water on burns. Ice can damage burned areas, and if someone with a burn gets too cold, they can develop hypothermia. Steps to treat a small burn. Make sure scene is safe. If the burn area is small, run it immediately with cool water, but not ice cold water. Run cold water on the burn until it doesn't hurt, and you may cover the burn with a dry, non-stick, sterile, or clean dressing. Image. Now, important information. Make sure to call 911 if there's a fire or person has a huge burn and you're not sure what to do. If someone is on fire, put the fire out. How the person stop, drop, and roll, like we all know. Now, steps to treat a large burn. Make sure the scene is safe. Call EMS. If the person is on fire, put the fire out first. Remove jewelry and clothing that is not stuck to the skin. Cover the person with a dry blanket and check for signs of shock. Cover the person with a dry blanket to keep the person warm, because once the skin is burned, the person can no longer control body temperature well and often gets cold. Electrical injuries. Electricity can burn the body on the inside and outside. It can stop or cause a deadly, abnormal heart rhythm. Signs of electrical injuries. It may leave only small marks on the body, and no one can tell how much damage there is on the inside the body based on the marks on the outside. How to treat. Make sure the scene is safe. Get the first aid kit and AED. Phone 911 when it's safe to touch the injured person. See if they need CPR. If they do, provide CPR. And a healthcare provider should check on everyone who has an electrical injury. Stay clear of the injured person as long as he's in contact with a power source that is on. Electricity can travel from the source through the injured person to the main power switch, only if you know how and safely to do so. Once the power is off, you may touch the injured person. If the electrical injury is caused by high voltage, such as a fallen power line, electricity can travel through everything that touches a power line or source, even a wooden stick. So wait until the power has been turned off to enter the area and provide help. Safety first, as your safety must be first before you treat others. Many people have heard about different ointments for burns. The only thing you should put on a burn is cool water and clean dressing, unless you're given other instructions by a healthcare provider. So here's an image of how it may be deceiving. Chemical burns. So it may be caused by alkalis, battery acid, and petroleum products. Do not apply water under high pressure, as it will drive the chemical deeper into the tissue. Don't try to neutralize a chemical even if you know which chemical is involved, as he may produce, resulting in more damage. Some product labels for neutralizing may be wrong. See the container or the label for the chemical's name. This pictogram is displayed on the packaging of corrosive chemicals. Levels of burns, so the different severities include first degree, second degree, and third degree. First degree is superficial and it affects the skin's outer layer, which is called the epidermis. Signs and symptoms include redness, mild swelling, tenderness, and pain. Healing occurs without scarring, often usually within a week. The outer edges of the deeper burns are first degree burns. So here are some examples. Sunburns is a common type of first degree burn. Second degree burn is partial thickness, extends through the epidermis and into the inner layer. Symptoms include blisters, swelling, weeping of fluids, and severe pain. These signs occur because the capillary blood vessels in the dermis are damaged and give up fluid into the surrounding tissues. So here are some examples. Third degree burns, so full thickness burns are severe burns that penetrate all the skin layers into the underlying fat and muscles. The signs and symptoms include leathery, waxy, or pearly gray skin that is sometimes charred. The skin has a dry appearance because the capillary vessels have been destroyed and no more fluid is brought into the area, and the skin does not blanch after being pressed because the area is dead. A third degree burn requires medical care and the removal of dead tissue and often a skin graft to heal properly. So here are some examples. Fun fact: your skin will not ignite unless it is heated to thousands of degrees. Practice. After a long hot day at the water park, your friend reports a severe sunburn on his back and shoulders. You have failed to apply sunscreen while at the water park. Blisters have formed and your friend refuses to sit up in a chair and reports severe pain. So the blisters and pain are signs that this is a first degree burn. Yes or no? You should break the blisters to relieve pressure and clean the burn. Yes or no? Cool compresses can be used to relieve the pain. Yes or no? You can apply antibiotic ointment and aloe vera to keep the skin moist. Yes or no? This person does not need medical care. Yes or no? So it would be no, no, yes, yes, and yes as well. CPR. Here's a video on how to perform CPR. And that is the final lesson of this series. Thank you for watching.